Okay, so what we're going to go through is sideline position for the Tuina massage. Some of this is for individuals who actually can't lie on their back, and some of it is just so you can access the meridians a little better and also access full range of the shoulders. So we're going to go through it. So your client is sitting like so. You're going to have them go ahead and lay on their side. Bring the bottom leg straight, and then place a bolster here, or you can use a pillow or whatever you would like here. Okay, so starting with the first idea, just the position in itself, you're going to have access to all the yin meridians on the inside leg. So all the yin meridians on the inside, liver, spleen, and kidney. So you have access to that. So some basic things you can do here are just basic pressing technique for people who have really tight adductors, or if they have some yin deficiencies, you can work along this channel in this way and up through the foot. Okay, remove the cat hair. Okay, so you have that there. Alright, so really we've used pressing technique. You can certainly use some rolling on the inside, though it is the inside of the leg, so some individuals might be pretty ticklish. So we typically do more just pressing. Now that's the inside channel, and that's easy to access that channel. Now on the outside leg, now we're looking at the 3 yang channels. So obviously you have working from the hip, you have gallbladder 30, so you have glute work that you're able to do through here. So whether you want to do rolling here, which feels really good, right at the glute medius and glute minimus, you have rolling down the gallbladder channel, IT band work, right on down the whole leg. So you have that whole access. So you don't have to bend over or go on your knees to do this. It does take time to transition, but you'll notice she's not draped, so to have access there is very easy. So this is one of those techniques where you could do it before they get undraped or when they are undraped. And then in another video we'll show you how to drape this sideline. So like so. So you got rolling, you got some pressing, like so. You can come over to the other side and you can work from this direction as well. So I'm taking the hands like so, and you can use the fin tui fa pushing. If they were undraped here, you could do that. Remembering that the flow of the meridian moves from the head to the foot, or face to the foot. So like so. Working right on down the channel. Or again, rolling with the other arm or other hand. Okay. For deeper work, we use our forearm revolved rolling. How does that feel? And then see I transition from this arm, rolling back down and towards myself, like so, and then I take my other. And you want to be gentle here because some people are really tender through the peroneals here on that lateral gallbladder channel side of the leg. So you can be assertive, but just be aware that you are right close to the bone in a lot of stabilizing muscles, so it can be more tender. Okay, so that's pressing like so. And then you can come here and do just the same technique with gallbladder and working the pressure point. So finding where the greater trochanter is, high point of the coccyx, and that line right between there, 1/3. So you want to go just off the greater trochanter and right in there. Tenderness in here at all? Okay, so it feels good. So So this here can be tender for some people if they have sciatic and you expose the muscle, because now this is in a stretch position, so we don't want to do too intense work here. So checking in, but making sure you're being assertive. So again, you can hold the point, you can knead the point, or you can do Zenfa on the point, which is the shaking or vibrating technique, Zenfa. Okay. Now those are just some of the basic ways you can work the body or the lower leg. Now you also have access to the QL muscles. So going right in, just at the, maybe a little ticklish, right in at the high point, and then you have the QL here, so you can access that right there. So I'm doing a thumb over thumb pressing technique like so. So you can do work right along the iliac crest and right along above the SI joint as well. Okay, which can be very tender for some people if they have low back pain. Feels good? Yeah. Okay. So right there. So just doing some good work in there, pressing, kneading. Some people you might be able to get an elbow in there. She's so small, she's hard for me to get in there with my elbow. So I just use my two thumbs stacked over top of each other. Okay. Good, good. Like so. Now for the sake of the video, so you can see what I'm doing, I'm gonna have you flip from end to end here. So stay facing that way and then bring your head here. Okay, we're gonna set her up like so. And now we did the QL work where we're working in here in her lumbar and her QL. Now you also have access to the arm. Okay, so we have access to the arm with rolling technique right on the shoulder. So if a person does actually have a shoulder issue, you can work on these here rolling. And I'm just kind of staying, you know, on that top yang side of the arm. The three yang channels, which are gallbladder, large intestine, small intestine, and triple warmer. And rolling there, you notice I'm kind of holding and stabilizing her arm here like so, and then rolling. Okay. Now, another easy thing we can do here too is you drape the arm here and hold here. Sometimes I take a seat here just to make it easier so I can relax a little bit. And then I have my hand cupped on her shoulder and the other. And then I'm going to do interlace finger grasping on the shoulder, like so. So that's a good one, like so, there. This is for like treatment of the shoulder. So you have access to rotate and move the shoulder in your arm like so. Okay, make them punch themselves in the face a little bit. Okay. And then, or you can go one knee here, sitting here. Now I also have access to gallbladder 21, gallbladder 21 at the high point of your shoulder. I have access to gallbladder 20 at the occiput, so all through the scalene. So you can do some really good neck work and stripping through the neck. It's a little hard to see, but I'm pushing up and through the neck. Okay, like so. Feels really good. Like so. Kneading in here with thumb. You can catch the top of that levator muscle there, which can be kind of tender for some people. You just kind of mobilize the shoulder or shorten it to get into the muscle a little bit easier. And then I can also do what I call the kalimba fingers, or harpsichord, I guess, where I'm playing like this. Okay, And I'm massaging with my fingertips, just all at the top of the traps and around that superior angle of the scapula. Doing some good kneading in there. And also I'm stretching the shoulder, so right here I can get a hold and traction back a little bit. Feels really good. Like so. Now the other thing, now we have the Yao-Fa techniques, or Ben Shin Fa and Yao-Fa techniques, which are the stretching techniques. So I can bring her arm up over here, and I'm stretching her like so. Feels really good as well. And then we have Yao-Fa. So now I can rotate her in a full range. So I grab here right around the forearm, or the elbow, just below the crease of the elbow there. Stabilize the shoulder, and I'm going to rotate full range. Just like so. So sideline shoulder work is next best to seated shoulder work when you're treating the shoulder. But as far as for like a routine, you go prone, side, other side, and then supine. That would be an easy transition. Okay, and you also have extension coming back, up and over, like so. Okay, so that's your basics there. Obviously you have access to the scapula behind, where you can hook in the scapula and pull the scapula into your hand and lift the scapula there. So just get a hold of the medial border of the scapula and lift, and you can work in there. Create some good space there for the shoulder to breathe, the ribs to breathe, and to help facilitate better deep breaths. Okay. So now, one of the ways that we do, they're also stretching, so coming back to the lower back, one of the ways that we stretch the body, like so. So you're gonna have them, I'm gonna grab her arm, both hands above the wrist, and I'm gonna pull. So her body already starts to rotate that there, you see? Now she's open here. I'm gonna have her hug here, and then I'm gonna have her hug here. And then from here, all we're gonna do is, this is a stretch, and it looks similar to the chiropractic adjustment, but it's not a chiropractic adjustment. We're just stretching. So, what's that?
The part that's hurt.
Yeah, we won't go too deep. She's got a little bit of discomfort in her lower back. So the idea here is you're gonna place your hand on their hand that's stabilized there, and then I say take 3 deep breaths. First one, you're gonna rotate their upper body back as you push here. So you can do this with your arms. You don't have to get the full body in it yet. And then she might take another breath. So now I'm gonna reach over and I'm gonna hook with my forearm. Okay, she did that exhale. Pull the hip forward and then rotate the chest back. We're not stretching her really deep because she's a little tender. Okay, and on the exhale you stretch. All right. Okay, in your books you're gonna see, take the knee and place it in here, and then do it this way. Okay, so I have my one knee up, placing it gently here, and going there. Now if this needed to get deeper at all, you just remove the bolster, and then the leg will be further down, and you do, well, actually let's do that. We're not gonna still go super deep, don't worry. Okay, so here, I place this in between. I rotate her, rock her towards me, rock, rock, and I pull it towards you, and then stretch here. Okay? Stretch there. All right, so that's the side line stretched there. Okay, so with any of that, let me know if you have any questions or if it was hard to see or anything like that. I can do some different angles so you can see, but I think you get the gist of how to work sideline for Tuina. Okay, great. See you in class.